Hi everybody, Joe Betcher here to show you how to do a very basic DVT ultrasound. To load the patient's information, click Patient in the top left corner. Click on the patient ID and load their MRN number, then just below that, enter the last name. Scroll down a little bit and enter your name in the Operator tab. We do have a barcode scanner, but unfortunately Trinity Grand Haven's barcodes are a little outdated, so it doesn't work quite yet. Click Probe, and then choose your DVT setting. You'll be using the linear probe for this scan. I grab a handful of towels, and I warn the patient that this scan is going to be pretty high up in the groin, as the scan starts at the junction of the saphenous vein and the common femoral. Scan near the inguinal crease to identify the femoral artery and the common femoral vein. With moderate pressure, the vein should fairly easily compress, while the artery should not. If you look in the superior lateral portion, you should see the junction of the saphenous vein draining into the common femoral. This is sort of my starting point where I begin all of these scans. You should also look to compress the saphenous vein. If you can compress that vein down 100%, they essentially do not have a clot there. There's other fancy things you can do, like color Doppler, pulse wave Doppler, but just keep it simple for now. If you can compress it, there is not a clot there. If the vein compresses without difficulty, then I'll follow it distally down the leg. About every 2 centimeters, I stop, I compress, I make sure it compresses 100%, and I save a video clip. Eventually, this common femoral vein turns into the femoral vein. Somewhere around halfway throughout the thigh, it'll dive deep into adductor canal, and you won't be able to see it anymore. I'll then switch to behind the patient's knee to look at their popliteal vein. The popliteal vein will always sit on top of the popliteal artery. It's the same concept here. Press down with firm pressure to make sure it compresses 100%. For now, let's hold off on looking at the trifurcation beyond this, as it's a little beyond the scope of this video. Here's an example of large common femoral vein DVT. You can see I'm trying to compress, but the vein simply won't collapse. You can see there's a large amount of echogenic material inside that vein. Here you see I take color Doppler and place it over the area of concern. I see normal flow in the femoral artery, but no flow through the vein. This can be helpful to confirm your suspicions when you think there's a clot. Continue to scan down the leg and determine where the clot burden is and which veins. Here you see a clot that's within the popliteal vein. Some of the common mistakes I see is accidentally calling a superficial vein one of the deep veins. This happens sometimes when you're scanning too laterally or superficially. Make sure you see the femoral artery next to the femoral vein. A Baker's cyst can also be misleading. Found in the popliteal region, are much larger than the typical vein and do not have this typical circular appearance and should have no flow within them. Lymph nodes can also be confused for DVTs. These are usually much more superficial and have this atypical continuous mild flow that's right in the middle of them. That's all I have for now. I'll try to keep it brief. If you guys have any questions, I'm always happy to help.